On March the 11th, 2020, the World Health Organization declared Covid-19, commonly known as coronavirus, a pandemic.
Covid-19 can be characterized as a pandemic.
To date, this pandemic has affected over 183 countries across the globe, with over 260,000 people infected and left over 11,000 people dead. This is a problem of epic proportions. Dr. Tedros Ghebreyesus, Director General of the WHO, has commented.
You must take a comprehensive approach. Not testing alone, not contact tracing alone, not quarantine alone, not social distancing alone. Do it all.
Most people infected with the Covid-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems are more likely, but are not limited to developing serious illness. The best way to prevent and slow down transmission is to be well informed about the Covid-19 virus, the disease it causes, and how it spreads. In this program, we'll be keeping you up to date on how you can protect yourself and others from infection. We will get the views of experts, speak to correspondents around the globe, and bring you the latest advice from the Hazuri Anwar. We'll also answer your questions regarding the coronavirus outbreak. Let's look at what has happened so far.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
Beijing has confirmed the number of people who have died from a new type of respiratory virus in China has now passed 40.
Worldwide, there are now just under 300,000 confirmed cases of coronavirus and almost 13,000 deaths.
The outbreak of coronavirus, which surfaced in a Chinese seafood and poultry market late last year, has spread to at least 147 countries, killing more than 11,000 and sickening tens of thousands of people in a matter of weeks. The World Health Organization has declared the situation a pandemic.
And we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
There are now more than 260,000 confirmed cases, most outside of China, where the virus originated. Europe is at the center of the crisis, with cases and deaths rising in several countries.
The death toll in Italy is now higher than anywhere else in the world, including China.
In Italy, nearly 800 people have died within the past 24 hours, bringing the total of deaths there to 4,825.
The WHO said it took more than 3 months to reach the first 100,000 confirmed cases worldwide, but only 12 days to reach the next 100,000. The actual number of people with coronavirus internationally is thought to be much higher, as many of those with mild symptoms have not yet been tested and counted. In response to the virus's spread, countries around the world are ramping up measures to try to slow it down. Governments have halted flights from virus-hit nations, locked down towns and cities, and urged people to stay home.
In a dramatic move to stop the spread of the coronavirus, President Trump has ordered an extensive travel ban.
I'm officially declaring a national emergency.
Schools, gyms, museums, nightclubs, and other venues have been shut, and people have been ordered to stay at home and seek permission for essential travel in a bid to slow the virus's spread.
Liebe Mitbürgerinnen, liebe Mitbürger, das Coronavirus verändert zurzeit das Leben in unserem Land dramatisch.
Germany's Chancellor Angela Merkel has warned that up to 70% of its population, some 58 million people, could contract coronavirus. In the UK, confirmed cases stand at 3,983, and 177 people have died. On Monday, Prime Minister Boris Johnson announced a shift in strategy, urging everyone in the UK to avoid unnecessary social contact and work from home where possible.
And I know it's been tough, and I know it has been inconvenient, but these actions that we're all taking together are helping to take the strain off our NHS. And bit by bit, day by day, by your actions, your restraint and your sacrifice, we are putting this country in a better and stronger position where we will be able to save literally thousands of lives of people of all ages, people who don't deserve to die now, people whose lives can, must and will be saved.
As the coronavirus pandemic continues to unfold, the constant stream of news can feel overwhelming. So we are here to help.
Many of you who are watching may have been affected by this pandemic, with businesses shut, schools closed, flights cancelled, and a state of emergency announced in many countries. But what is Huzoor's advice with regards to this matter, and what should we be doing to help ourselves and the world at large?
जब बीमारियां आती हैं, वबाएं आती हैं, तो हर एक को अपनी लपेट में ले सकती हैं। इसलिए हर एक को बहुत एहतियात की ज़रूरत है। हुकूमती हिदायत पर अमल करें। बड़ी उम्र के लोगों, बीमार लोग, ऐसी बीमारियों में मुब्तला लोग जिनका क़ुव्वत मुदाफ़ियत जिस्म की कम हो जाती है, उनको बहुत ज़्यादा एहतियात करने की ज़रूरत है। बड़ी उम्र के लोग घरों से कम निकलें, और यही हुकूमत का ऐलान भी है। सवाए इसके कि बहुत अच्छी सेहत हो, उमूमन घर में रहना चाहिए। मस्जिद में आने में भी एहतियात करें। यहाँ तक जुमा भी अपने इलाके की मस्जिद में पढ़ें, और आज की यहाँ हाज़री से भी लग रहा है कि अक्सर लोग जुमा अपने अपने इलाकों में ही पढ़ रहे हैं। सवाए इसके कि इस बात पर भी हुकूमत की तरफ से पाबंदी लग जाए कि जुमा भी के लिए गैदरिंग भी ना हो। औरतें अमूमन मस्जिद में आने से परहेज़ करें। बच्चों के साथ आती हैं, उनको परहेज़ करना चाहिए। फिर अमूमन डॉक्टर भी आजकल यही कह रहे हैं कि अपनी जिस्म की क़ुव्वत मुदाफ़ियत बढ़ाने के लिए अपनी आराम को भी पे भी तवज्जो देनी चाहिए। उसके लिए अपनी नींद को पूरा करना चाहिए। अपनी नींद पूरी करें, खुद भी और बच्चे भी। ये बड़े आदमी के लिए 6-7 घंटे की नींद है, बच्चे के लिए 8-9 घंटे या 10 घंटे की नींद है। इस तरफ तवज्जो देनी चाहिए, नहीं कि सारी रात बैठ के टीवी देखते रहे और 12 बजे तक उसके बाद सुबह उठ के तो नमाज पे ना उठ सके, फिर जल्दी जल्दी उठे, चंद घंटों के बाद काम पे जाना है, उसकी मुश्किलात, फिर सारा दिन सुस्ती, फिर कमज़ोरी, फिर काम की थकावट, और इसी वजह से फिर ये बीमारियां जो है हमला भी करती हैं।
Now, to discuss this further, I'm joined with Asif Basit Sahib. Asif Sahib, what's the latest guidance from Huzoor Aqdas?
Dr. Kaleem Sahib, the latest guidance from Huzoor, which went out yesterday in Al-Hakam and Alhamdulillah was widely circulated thanks to the modern means of communication, is that there should be no room for speculation. The message from Huzoor is very clear. It's simple and loud and clear. So that leaves us with no room to be making any kind of speculation, because there were circles even within the Jamaat where speculations were being made to be, questioning whether it is a pandemic which is of a type of a sign in itself, like the plague from the time of the Prophet ﷺ. So Huzoor's latest instruction is that if it was a sign from God, and if it was of that type, the way the pandemic of the plague spread across the globe in the time of the Prophet ﷺ, the first one to identify that would be Huzoor. The first one to announce that it is would be Huzoor, Ayyadahullah Ta'ala bin Nasril Aziz. So keeping this in mind, no one absolutely has the right to say this is such and such and this is not such and such. So the fact of the matter is that it is a pandemic, it is a worrying situation, and the advice from Huzoor is clear, and that is probably the only source of comfort that we have at the moment. We've just also heard in the VT, Huzoor's advice, we're playing it on MT as well repeatedly, is that, to follow the instructions that we're getting from the medical experts and through our government authorities especially, stick to them, no speculations even in that regard as well, whether it's right or not. I mean, washing your hands can sound like a mummy's advice to their young kids. It might sound like anything, but it has to be followed to the letter. That is the best advice that is coming out at the moment. Social distancing, Hazur has obviously mentioned that as well. We've seen Hazur taking particular care in this regard in Mubarak Mosque, that the cleanliness and general hygiene is maintained. We've got special prayer mats there as well, which can be taken off and washed and then placed back. So Hazur said that if there is any instruction, it has to be followed. We should feel very fortunate. Like, there is a hadith in where the Holy Prophet ﷺ said, Al-Imamu Jannatun, the Imam is a shield. So we are very fortunate that in this time of this pandemic spreading across the globe, we have a shield to take refuge behind.
Azur's elaborated on the fact that people should listen to the advice given in their respective countries. Absolutely. We know that the ulama in different countries have been saying the contrary, in fact. What is the state of play with regards to the nature of the advice being given, for instance, from the WHO, and what has Azur said with regards to this?
Any advice that comes from such bodies like the WHO and like the governments, because in the wake of this coronavirus situation, all governments are actually looking at WHO. WHO is working very closely with the governments. So anything that comes from such bodies like the World Health Organization needs to be followed to the letter. Nowhere has Hazur ever said that don't listen to them and some other advice will be coming from such and such source. The only instruction that we've had from Hazur in terms of what we should be doing is respecting what we're being told by such bodies like the World Health Organization.
And Jazakallah Asif Sahib, for all of you watching MTA International, please remember that this is not the only program about this virus, the coronavirus, and the situation that's affecting the world. There are many other programs, so please stay tuned to MTA International for regular bulletins and broadcasts with regards to the COVID outbreak. Now, all of you know that the Ahmadiyya community is spread throughout the world, and many of you will be watching and would be interested to know how your brothers and sisters are coping and what are they doing in their respective countries, both for themselves and for the country at large. We are now going to speak to two experts in the field, Dr. Nair Ahmed, who is an assistant professor of microbiology at the University of Pittsburgh in the United States, and Dr. Majid Rana Sahib, who is a maxillofacial surgeon specializing in upper respiratory tract infections from Germany. Let's speak to Majid Rana Sahib first. Rana Sahib, there are many people who are speculating or thinking this coronavirus will not affect us. We are Muslims, we are clean, we have been shaking hands for years. Why should we change our habits, particularly the elderly who are affected by this? They do not seem to understand why they have to go into isolation. What's your message to them?
Yes, thank you, Dr. Saab, for this question. Definitely, I need to tell to the people that this is a new virus. The virus is creating, especially to our older people who have pulmonary diseases, cardiovascular diseases. This virus will affect them. This will affect them on their general health situation. This will affect them to treat them and make them ill. So my advice to the people is, please stay at home. Like the guidance of Hazur Yaqtas is, try to keep away from younger people, because the younger people are those who can have the virus without showing any type of symptoms. And this virus will affect the elderly people, and the elderly people can get sick. And nowadays we don't have proper medications to solve that.
There's also this conception that perhaps you can gargle with salty water, or you can eat excessive garlic, or there's a particular herbal medicine or desi totka which will allow you to be prevented from having this infection. What's your message to those people spreading such news on social media?
So none of these recommendations protects you from getting COVID-19. And some of these practices can even be dangerous. The best way to protect yourself from this coronavirus is washing your hands frequently, using soap and hot water. Avoid close contact contact about 6.5 feet or 2 meters, and stay away from sick people, people who are sneezing or coughing. In addition, you can spread, can avoid to spread your own germs away into the crook of your elbow, and you can sneeze into your elbow. That's the best way for protection.
There's also this perception that the virus hasn't affected our country yet. I know from Pakistan, many people are thinking that the coronavirus hasn't really hit us, and people are confused what to do. In particular, those people who are in joint family systems where the several generations are residing within the same house. How should they implement isolation into their own lives?
So a very important question, especially to our community. And I think the Ahmadis nowadays need to be careful, because many of us are living with 3 generations all together. And the most affected part is our risk group, the older one with cardiovascular or pulmonary diseases. So we need to do something like a quarantine into the houses. That means the people, the older people, need to stay away. One way is for them to use mobile phones. They can communicate via mobile phones. You can help your nephews or your niece to recitate the Holy Quran. You can do prayers. But what is very important, please stay in your rooms and have fresh air in your rooms, move around in your rooms, and stay away from them.
Jazakallah, thank you very much for that. Let's go on to our other guest. Nair Sahib, you're joining us from the United States, and you're the Assistant Professor of Microbiology at the University of Pittsburgh. Social media is good. It informs us a lot of what's going on, but there are also some problems with it. There's a lot of misinformation. We saw that there was information going around that, oh, this is not as dangerous as TB or as influenza. How seriously should members of the Jamaat and the world at large be taking the problem of coronavirus?
Assalamu alaikum, Jazakallah for inviting me. And before I proceed with my answer, I just wanted to extend a warm Assalamu alaikum to Hazur as well. The real issue that we're having here is that people are definitely taking it very lightly. If you compare the flu to coronavirus, we're basically comparing apples and oranges here, to be honest, because, for example, the mortality rate that we have with the flu virus stands at about 0.1% to about 0.2%, which basically means that out of 100 individuals that get infected, the mortality rate is very low, as opposed to the coronavirus, where we're seeing that the mortality rate is about 3 to 4%. And, in certain cities like Italy, we've also seen that the number has crept up to about 6% because it's been occurring in places that has higher demographic of older people. So we still don't know what the true impact it will have, because there's only a few thousand people that have been infected so far. With the flu virus, for example, we have about 26 million people getting infected just in the United States. So we just have to wait and see how dangerous this is. But so far what the numbers are showing us is that it is more deadlier and far more contagious, which means it spreads very easily from person to person compared to flu or any other disease. Jazakallah.
Jazakallah. I'm very sorry we're out of time. We would love to have stayed with you for some more questions, but we're now coming towards the end of our program. So to summarize, there are 2 things we must do. Firstly, pray, and secondly, take precautions. Both have to be done together, and one alone is not enough. Let's hope and pray that, as Hazur has instructed the Jamaat, our Jamaat should help each other and help humanity as a whole to be protected from the effects of this outbreak. With this, we conclude this program, and we look forward to being with you again. Jazakumullahu wa sanal jaza. Assalamu alaikum wa rahmatullahi wa barakatuhu.